All right, welcome back, everybody, to the Deep Dive. Today, we are courtesy of Radiology Bits, and we are going to go deep into the world of chest radiology.
Sounds fun.
Yeah. We are going to explore something called Pectus Excavatum.
Oh, cool.
Yeah, it's really interesting. You know, some people say, like, oh, my heart feels squeezed, or, you know, like something's weighing on my chest.
Yeah.
Well, imagine your chest bone actually, like, putting pressure on your heart.
Whoa.
Yeah. That's the reality for people with this condition. So
That's Pectus Excavatum.
that's Pectus Excavatum. It's a
fascinating condition and surprisingly common. It's actually the most frequent congenital sternal abnormality out there, meaning people are born with it.
so what you're saying is, instead of a nice flat chest bone, which, you know, anatomically that would be the sternum,
Right.
it's caved inwards.
Exactly.
Like a dent, you know, you think about like a dent in a car,
Yeah.
but on your chest.
Exactly. And while most people have it from birth, you know, they're born with it, it can sometimes develop later in life due to like a trauma or even chronic illnesses.
Interesting. And our source has mentioned it's 3 times more common in guys.
Oh, yeah.
What's up with that?
That's a good question.
Yeah.
The exact reason is still a bit of a mystery, but we know there's a genetic component.
Like a predisposition.
Yeah. Almost half of the cases, it runs in families.
Wow.
And then interestingly, Pectus excavatum, it's sometimes linked to other connective tissue disorders, which adds another layer of complexity to it all.
Okay, so genetics play a role.
Yeah.
But how do doctors figure out if someone has this, besides, you know, actually looking at their chest?
Right.
Like, can you see it? Is it that obvious?
Well, that's where our trusty X-ray comes in.
Okay.
A frontal chest X-ray can show some telltale signs like haziness along the right side of the heart and the heart being pushed slightly to the left.
Okay, so I'm trying to picture this in my head, right? So how can doctors tell the difference on an X-ray between Pectus excavatum and something like, let's say, pneumonia? Because it seems like they both could cause like a haziness on an X-ray, right?
You're right. It can mimic other conditions.
Yeah.
That's why doctors often take like a side view X-ray, or even better, a CT scan.
CT?
3D. They give a clearer three-dimensional picture, literally.
Wow, so they can actually measure how much the sternum's caved in.
Yeah.
I'm guessing that's important for figuring out how serious it is, right?
Absolutely. We use something called the Haller index.
Okay.
Think of it as a way to kind of quantify the severity of Pectus excavatum.
Okay.
It's basically a ratio that compares the width of your chest to the depth of that inward curve.
Okay, so a higher Haller index means a more severe case.
Exactly.
The kind of number we're talking about here for like a serious case.
A Haller index above 3.25, that often indicates potential problems.
Problems like what?
For the heart and lungs. Oh, wow.
You see, the more the sternum is pushed in, the more it can restrict the space your heart and lungs have to function properly.
Oh, so they're literally being constricted.
Yeah.
Okay.
And that can lead to, you know, things like shortness of breath, decreased exercise tolerance, and even palpitations in some cases.
I never realized, you know, a condition like this could actually impact heart function.
Yeah.
What's it like, I guess, for people living with like a severe case of Pectus excavatum?
Well, as you can imagine, it can significantly impact their quality of life.
Yeah.
Simple things like climbing stairs or exercising can become really challenging.
Oh, wow.
Some people experience chronic pain. And then there's also, of course, the psychological impact of living with a visible chest deformity.
Yeah, I can imagine that could be really challenging.
Absolutely.
I mean, no wonder surgery is sometimes needed.
Exactly.
Yeah.
And the NUS procedure is the most common surgical approach these days. It's considered minimally invasive.
And basically what they do is they insert a curved bar, almost like a scaffold, under the sternum. And over time, this gently reshapes the chest.
It's like giving your sternum a brace.
It is. It is.
Wow.
It's quite remarkable.
Surgery sounds intense.
Okay.
Are there any downsides or risks associated with this procedure?
Like any surgery, there are risks.
Yeah.
But the NUS procedure has a really high success rate, and most patients experience significant improvement in their symptoms and their quality of life.
That's really good to hear.
It is. It is.
So surgery is for like the severe cases?
Right.
But what about less extreme cases?
Yeah.
Does mild Pectus excavatum, does it still cause problems?
Even mild cases can cause chest pain in some folks.
Yeah.
And let's be real, it can impact self-esteem.
Yeah.
So sometimes surgery is done for cosmetic reasons too.
Yeah, that makes total sense. It's amazing how much we can learn from a few x-rays and CT scans, right?
It is.
It's like you're looking through a window into the human body. Big thanks to Radiology Bits for taking us on this journey.
Of course.
It really highlights how imaging helps us diagnose and manage conditions like Pectus excavatum,
Absolutely.
It's fascinating. And for everyone listening out there, here's something to think about.
Okay.
We've talked about, the physical aspects of this.
Yeah.
And even the cosmetic aspects.
Right.
But what about the social and emotional aspects?
Oh, yeah.
How might this condition impact a person's self-image and their social interactions?
That's a great point.
Something to ponder.
Yeah.
So, until next time, keep those brains curious and stay tuned for more deep dives.